saying that when life gives you lemons, you should make lemonade. Being diagnosed with multiple sclerosis is like being handed a bushel of lemons. Yet someone newly diagnosed actually has a wealth of information to help them understand their illness and can actually help them to make the right decisions in their course of treatment. Many have admitted to knowing someone that has been affected by multiple sclerosis, yet they know so little. So this is why I have chosen this as my topic of discussion. This topic is of great importance to me because I was recently diagnosed with multiple sclerosis, or MS, found on an MR scan, which happened to be a very popular test done to rule out multiple sclerosis. I now know that MS is something that will affect me for the rest of my life, so I'm interested in sharing what I've learned thus far. I would like to talk to you about what MS is, the different types of MS, the cause of MS, symptoms, who is affected, courses of treatment, and finally, information on where one can find support. I must admit, as a technologist, I am familiar with what MS looks like on an MRI scan, and I knew that most patients experience numbness and tingling. But after researching this disease, I've realized that there's so much more to it. First, the definition of MS and types of MS. The National Multiple Sclerosis Society defines MS as an unpredictable, often disabling disease of the central nervous system that disrupts the flow of information within the brain and between the brain and the body. There are 4 types of MS. Number 1, remitting relapsing, which is the most common. Number 2, primary progressive MS. Number 3, secondary progressive MS. And number 4, clinically isolated syndrome. Multiple Sclerosis News Today identifies and defines the types I mentioned in an online article titled 4 Types of MS. Shortly after receiving my diagnosis, I was referred to see an MS neurologist to discuss the type of MS I have and also to discuss the symptoms and plan of treatment. I have relapsing remitting MS, which means that my flare-ups or symptoms experience aren't ongoing. They normally last for a short period of time. One should be familiar with what causes MS and also be aware of the symptoms associated with this disease and who it affects. The immune system attacks the myelin layer, which is the outer coating of the nerve fibers in the central nervous system. It strips it and it forms plaques or sclerosis in its place, hence the name multiple sclerosis. An example of this is a person with multiple sclerosis. He may experience arm pain with some numbness and tingling down the arm. This is likely caused by the nerves from the neck vessels that causes that effect. Under the National Multiple Sclerosis Society site, under symptoms, it states that no 2 persons have exactly the same symptoms. WebMD lists some of the symptoms experienced by those with multiple sclerosis, and they include trouble walking, feeling tired, muscle weakness and spasms, vision problems such as double vision and blurriness, numbness and tingling, sexual problems, bladder and bowel control issues, pain, depression, and problems focusing or remembering. The National Multiple Sclerosis Society states in the article, "What is multiple sclerosis?" that the effects are often different for everyone who has the disease. Some people have mild symptoms and don't need treatment, while others will have trouble getting around and doing daily tasks. You might now wonder who is affected. The National Multiple Sclerosis Society states it normally occurs between the ages of 20 and 50 and is 2 to 3 times more common in women. My symptoms are right side neck pain with spasms in my right arm and numbness and tingling in my right thumb. After my diagnosis, I wondered what my course of treatment would entail. There are no current therapies to totally cure multiple sclerosis, yet there exist therapies to help alleviate symptoms and prevent new lesions. This was taken from the Multiple Sclerosis Today. Mentions 2 basic MS treatment approaches are immunomodulation therapies, which controls the myelin sheaths and helps to restore the central nervous system. And there's supportive therapies, which helps the patient live a normal life. My neurologist gave me 4 options that have proven successful in others with relapsing remitting multiple sclerosis. Yet, there are a lot of side effects associated with these drugs, so I've had to undergo tests like blood work, EKGs, and I have to undergo an eye exam before starting any of these medications. And I also have to follow up with the same test every 6 months to see if there has been any negative effects on my body. After my first and second visit with my neurologist, I was armed with a ton of information to help me make the best possible choice for my condition. Since my MS isn't that progressed, I've decided to pursue a less aggressive medication at this time. He also directed me to look at the website National Multiple Sclerosis Society.org for the most current and updated information regarding this disease. I have covered the basic information for someone newly diagnosed with MS, the definition of MS, who it affects, the course of treatment, and where to find support. Yes, MS is like receiving a bushel of lemons, but with the right support, you can make MS lemonade. Thank you.
All right.
The end. Thank you.